Good morning. Welcome to our video presentation for MedPro Diagnostic Imaging. I am Dr. Siegel, and I am a board-certified physician and diagnostic radiologist. I was trained in and work in cross-sectional imaging. Ultrasound is an extremely useful tool in diagnosing many types of medical conditions. Ultrasound happens to be one of my passions, and I find it extremely helpful for general practitioners and subspecialists in helping them determine the cause of a patient's symptoms or clinical findings. Ultrasound can be done in almost any location. It is safe, it is non-invasive, and doesn't require the use of any radiation. There is usually little in the way of patient preparation. I'm going to introduce you now to our ultrasound technologist, Layla, who is going to be working here today doing ultrasound exams on several different types of patients. Layla. While Layla is performing these exams, I will be describing to you the type of exam she is performing and its uses in diagnosing patients' illnesses. Layla is going to be performing an abdominal sonogram on this patient. An abdominal sonogram is usually done to visualize the abdominal organs. These would include the liver, gallbladder, pancreas, bile ducts, abdominal aorta, and spleen. This helps to detect a wide range of conditions and also assess the blood flow to these organs. Ultrasound can also be very useful in detecting cysts, abscesses, obstructions, fluid collections, clots, and even infections in the abdomen. In a recent study, the general practitioner's anticipated patient management strategy was changed for 64% of patients following upper abdominal ultrasound. Negative findings are very important for the exclusion of diseases and therefore for reassurance of the patient. Abdominal ultrasound substantially reduced the number of intended referrals to a medical specialist, and more patients could then be reassured by their general practitioner. There's no discomfort, risk, or radiation exposure with ultrasound, and there are some conditions, though, that could interfere with the results of the abdomen ultrasound exam. These include severe obesity, intestinal gas, and barium that's left in the intestines from a previous GI series that may have been performed recently prior to the ultrasound exam. The main indications for use of abdominal sonography include abdominal pain, which is the most common indication, abnormal liver function tests that are received from blood work, enlarged abdominal organs felt on palpation during physical exam, possible gallstones or kidney stones, other abnormal lab results that are suggestive for abdominal pathology, or even in an oncologic patient who has a known primary cancer in the search for metastatic disease.